I just want to share some reflections on this. I think that's the idea also on this. We have several hats. Here it's my hat of IDF Europe, the head of APDP, the Diabetes Association, the oldest diabetes association in the world. But it's also my perspective of public health professor at the University of Lisbon, and also knowing some of the realities of healthcare systems in the large European region with another part-time job that I have with WHO, where I am confronted with different health systems, as Chantal was mentioning, and that's something that we have to come to the discussion, how to implement this within different healthcare systems perspectives. And I have as a first reflection something about our mixed message to the society and for people living with type 1 diabetes for the last decades. For one side, for the community, we are always speaking about how serious is type 1 diabetes, the serious initial diagnosis, and we've heard about diabetic ketoacidosis, the permanent risk of living with diabetes, type 1 diabetes, the need for support, the need for innovation on treatment, the life expectancy, shorter life expectancy, even with high-level care. And then for people living with diabetes, we just say it's a chronic condition. You can live a normal life. And so even when we deal with these two levels of society, we are dealing with two mixed message. So the normal life and the very serious condition. And of course, we know that's not a normal life, and I think later on this discussion we can hear about that part that's really not the normal life. And the screening. I told you that I'm a public health professor, and for many years I've been telling that a good example of not doing the screening was for type 1 diabetes, because we didn't have anything to offer for type 1 diabetes. So why do a screening? Expensive, increasing the anxiety, and actually not doing anything. So, and that's our baseline status here in most of the European region. And so how can we change that perspective also? I think that's the discussion here, because that implies the healthcare professionals, people living with diabetes, families, general population, and governments and policymakers. So what has changed? We have now more knowledge on disease mechanisms and the benefits of early, even the classic intervention with insulin. We have less expensive tests to be used, and I think that's quite relevant also when discussing this. And of course, we have new pharmacological disease-modifying therapies coming to the reality. And that's something that we have to be ready to that and to offer that to people at this stage of the disease. We've heard that APDP is implementing the Identify project, and actually, I think it's a good start to define what are the steps to have a success story on this. And it's not easy, but it's much easier than we thought before. And so, because we are part of this structure. And so, we have the definition of the screening, but that's choosing the test, choosing the labs, be sure that the labs are certified, quality certified, and that's also the relevance of this project here, to decide where and when, and the resources allocated to that. And that's the discussion at every level. But it's not, screening is just the first step. We have to define the follow-up protocol. And if you've been part of Identify, you know how much we discuss what's the real protocol for follow-up, because we are still dealing with a part of unknown reality. And we have to be sure on that and be sure that we assess every step, every decision that we take. So, because it's not easy, and we have to be sure that we know that's not easy. And then we have to measure the impact. And that's something also very relevant in Identify. We are assessing multi-dimensions of this process: the health, the financial impact, psychological impact. Because it sounds, probably for people not living with type 1 diabetes, probably it sounds perfectly clear we should do this at ease. If you ask people living with type 1 diabetes, they can have a kind of a second thought on that. Why should I do that for my family? So what's the impact of doing this early assessment at the population level? And we took good care of that. We are assessing that, and it seems feasible, doable, and as long as we have a common strategy to address that impact. And then it was also important for us to know the healthcare professionals' perspective, because again, we were taught that screening was not relevant for type 1 diabetes. So we have to change perspective from the healthcare professionals. Otherwise, we can have a fantastic process implemented, and then suddenly the pediatrician, the family doctor would say, why doing that? Why do you want to do that? And suddenly everything stops there. So if we want to implement this kind of strategy, and we have done that in Portugal, we have to try to attain all those levels. So high-level commitment from the policy perspective, be sure that all the healthcare professionals, or most of them, would be on board of this process, and finally, but not the least, to have the perspective of people living with diabetes in the process also. And so they were invited to be at the Congress, at all the meetings, because we want them to be part of that and say how important is this process. Not because it's changing their life of living with type 1 diabetes, but to demonstrate what is the normal life of people living with type 1 diabetes. And that's something that we also think that's very important. So, to conclude, I'm sorry for this, I told you that people living with diabetes still can't live a normal life, and that's at every level. I think Europe can certainly show the world the example of implementing a new health intervention that has a huge impact. And we have to be sure also that making early diagnosis doesn't imply a higher number of people living with stigma and discriminations, because we have to note that living with type 1 diabetes is also related to discrimination with jobs, insurances, and when we are doing this early diagnosis in pre-symptomatic phases of type 1 diabetes, we have to be sure that our society is ready to have that people on board without penalizing them, without having an increased cost of that diagnosis. And that's something that we also have to discuss here. So imagine Europe and the world without children being admitted to intensive care units with life-threatening conditions, being able to sleep, live real normal lives. Imagine also that that would be possible also for adults, because we are not speaking just for children. People grow and be adults, and that we are speaking about their life also. So we are really foreseeing a real new world, and these are really fantastic times. So for success, I think we'll have to have clear message, strong political commitment, we have to have resources, we have to be able to measure impact, and have research supporting all this, and involving people. I think that's one of the good examples that we have in Europe to show the rest of the world the way we involve people in our decisions and implementing policies. Thank you so much.